it's a case which shows you a number of things. One thing it shows you is what medicine is able to do, and also what can happen to patients, and also how difficult it sometimes is to make a decision what to do with the patient. Now, this is also a patient of mine. She's a 44-year-old woman with dilated cardiomyopathy, and I've been following her for many, many years, and she was kind of stable at the beginning, but she deteriorated very quickly over the years, and she got worse and worse and worse despite heart failure treatment. And the images I would like to show you are pretty impressive. This is the image I have from her, which was made, I would say, a year ago. But look at her left ventricular function. What you see here is very poor left ventricular function. Okay, a very large left ventricle, a large left atrium, and then they put a pacemaker in her. Now, the problem with the whole thing was that they just put a normal pacemaker in her because she had bradycardia, and they did not give her a CRT. So, first of all, she also has dyssynchrony because of just simply having a pacemaker and not a CRT system. And then she also has deteriorating left ventricular function. And she has one other thing I want to show you. Just take a look at the aortic valve. Okay. And if you put the continuous wave Doppler signal across the aortic valve, you can see that there's an elevated velocity, which means she has aortic stenosis. A very difficult situation, because now she not only has a poor left ventricle, but she also has dyssynchrony, and she has a fairly high afterload because of the aortic stenosis, which is another burden to the left ventricle. And when we had her at the clinic, we took a look at aortic stenosis, asking us the question if this was low-flow aortic stenosis or not, or if this was just an association of aortic stenosis with cardiomyopathy. And we put her through all sorts of tests, including stress echocardiography, and we came to the conclusion that her contractile reserve was not very good, and we were not able to tell definitely if aortic stenosis was here first and then left ventricular function deteriorated, or if she has both mild to moderate aortic stenosis and cardiomyopathy. Nevertheless, the question was, what can we do with the patient? And at that time, she was, I would say, we could still stabilize her with medication, I would say. So we left her the way she was. And I saw her, I would say, probably 4 weeks prior to this webinar, to today, 4 weeks ago, and she was in very poor condition. Unfortunately, I do not have the echo with me of her left ventricular function, but it deteriorated even more. She had an ejection fraction of 5 or so. So the question was, what are we going to do with her? And I would like to ask this question to you, and I would like to pose this question to you. What are you going to do with this patient now? Are you going to give her a CRT, a left ventricular assist device, conservative treatment, maybe even heart transplantation? Okay. I'm aware that many of you might not have all these options available in your institution, but just from an academic point of view, where would you go? Okay, I'm going to close this in a few minutes, so please vote. Only half of you have voted so far. Remember, this is a young patient. She does not have any other diseases. Her kidney function is still okay, but she is in low output failure. Okay. Okay, so most of you say heart transplantation. Good. This is also what I did with her, or at least that's what I suggested. Obviously, there was no contractile reserve. So valve operation is not an option. CRT, well, I think that dyssynchrony certainly is a problem, but I kind of doubt that the CRT system is really going to make her left ventricle normal. This is certainly not an option. A left ventricular assist device is certainly an option. You could place her on a left ventricular assist device, especially for bridging. But then, of course, the question is, what then? Basically, we thought that it would only be something we could use as a bridging strategy towards heart transplantation. So what happened to this patient? Well, I'll give you the story, which is a fairly long story, but I'll try to make it short. She was put on the transplant list, and she called me at night and said, you know what, I just got the beeper, the heart is here, I'm ready for the heart. I'm so happy to get this heart. And she went into the clinic and she got this heart transplant. Done. So the heart transplantation was done, and everything went fine, perfect, until a few hours after the transplantation, when she had a recurrent bleeding, which was very severe, as a matter of fact, and which was diffuse. So she was brought back down to the surgical ward, where they got a hold of the bleeding. However, the problem was that her left ventricular function was deteriorating of the graft. So left ventricular function was poor, but it did recover in the days afterwards. And then I went up back to the ward to take another look at the echo, and this is the echo that I took of the patient with her new heart. Okay, let me go back. Well, I can't find the echo now. But anyway, so what I saw was that the left ventricular function was really okay again in this left ventricle. So the ventricle kind of recovered. But then 4 days later, after everything was already, towards weaning, she again had a breakdown. Her heart stood still. There was complete heart failure. There was complete coagulation of blood within the heart. The LAD was completely coagulated. She was brought down to the surgical ward, and then the heart was explanted, and she got a biventricular assist device, and she was then again brought back up to the ward, and I'll show you just the images of the patient as she's on the ward. Now this is the assist device. 2 pumps that were used to assist both the right and the left heart. This is the patient with tubes coming out all over. I mean, she's a slim patient. You can see she was full of fluids. Those were the perfusers that she got. And basically, this is how the pump was installed. For all of you who are into left ventricular and biventricular assist devices, this is the explanation. Basically what it does, it's a totally artificial heart, where the heart is external to the body. Well, to make things short, she is still on the ward with this pump now. It's only 3 days that she got this pump, but the big problem will be if she will recover neurologically, because basically she had a fairly long ischemic time from the brain. So I'm afraid that she will have problems, and she will not be a candidate for transplantation, because obviously what should be the next step, if she would recover, would be to give her a new heart. So I'm afraid that this will not end very nice, or not good for the patient. But I just wanted to show you this patient because it's very interesting to see also what happens and what can come out of these patients.